Patients should be seated quietly for at least 5 minutes in a chair with back support, with your feet flat on the floor and your arms supported at heart level. Patients should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes preceding the measurement. Next, I will show you what equipment will be used in this procedure. The first piece of equipment is the blood pressure cuff. Then we have the stethoscope. Make sure the ear tubes of the stethoscope are facing outward, not inward, in order to get more accurate readings. Make sure the valve is tightened to the point where you can pump into the cuff, but not too tight that it will hinder the accuracy of the measurement. Next, make sure to take the blood pressure on the left arm of the patient and roll up the shirt sleeve. Place the cuff on the patient, making sure 80% of the upper arm is covered. Place the chest piece of the stethoscope over the brachial artery, which is located between the bicep and the forearm in the area where the elbow bends. If you know the mean blood pressure value of the patient, inflate the bulb to 20 millimeters of mercury above that average. If not, inflate the bulb to 180 millimeters of mercury, then slowly release it at a rate of 2 to 5 millimeters per second. Listen very carefully, for when you reach the systolic blood pressure, you will hear the first thump sound of many to come. This is called the Korotkoff sound. The last of the sound you hear during the measurement is going to be the patient's diastolic blood pressure. If patient's systolic blood pressure is less than 120 and diastolic blood pressure is less than 80, then the patient can be classified as having a normal blood pressure. For the prehypertensive stage, the patient's blood pressure will be between 120 and 139 for the systolic, and for the diastolic between 80 and 89. For stage 1 hypertension, the patient's systolic blood pressure will be between 140 and 159 millimeters of mercury. The diastolic blood pressure will be between 90 or 99 millimeters of mercury. For stage 2 hypertension, the patient's systolic blood pressure will be greater than or equal to 160, and the diastolic blood pressure will be 100 or equal to 100 or less than 100 millimeters of mercury.